Good afternoon. I'm Anna Carpenter. I'm a student at East Tennessee State University, and this semester I'm taking Intro to Service Learning. I'm in the 0089 section, and this past semester I served at the VA Medical Center in Johnson City, and today I would like to touch on some of the impacts that the COVID-19 pandemic has had on the VA Medical Center. So as I said, my service learning site was at the VA Medical Center in Johnson City, and before the coronavirus pandemic, I was able to serve 9 hours there. And the population that this facility serves is named the Vision 9 population. So this is a veteran population of Johnson City and also the surrounding areas. The nearest other VA medical centers are in Asheville, North Carolina, and Nashville, Tennessee. So the veteran population of Tennessee, as you can see in this graph I made, many of them are above 65, with the highest number of veterans being in the age group between 65 and 69. The CDC is saying that individuals over the age of 65 are at higher risk of developing severe illness if they do develop COVID-19, and this means that they are a high-risk group and vulnerable to COVID-19. So it's really important that these VA medical centers are able to provide care for these veterans and protect them from COVID-19. So to protect veterans and everyone at the VA Medical Center, there have been many changes implemented in the medical centers, and some of the ones that I experienced before no volunteers were allowed to serve there are some changes that went into effect on Monday, March 9th, 2020. I was able to serve on the 10th of March, and here's some of the changes that I saw while I was there on the 10th. Everyone was only to enter through the main entrance. All the side doors to the main hospital were closed off. That no visitors were allowed. They were still accepting volunteers at that time. And all patients were being screened upon entrance, with the first question being, do you have an appointment today, to make sure that they were a patient. Some of the other screening questions were, have you traveled recently? As we knew at this time that many other countries were experiencing coronavirus hotspots, and some other states had a lot of COVID-19 cases. Also, have you experienced any fever or cold or flu symptoms, or have you been in contact with anyone experiencing those symptoms? Because we knew that those were some of the main symptoms of the coronavirus. And I did some research on what changes have been made now. So up-to-date COVID-19 responses that have been made. They are still screening upon entrance to all VA facilities, health facilities. There is still a no visitor policy at both hospitals and long-term care facilities. Long-term care facilities are not accepting new admissions at this time. They are recommending that veterans use telehealth for routine appointments, so come into their appointment and visit with their doctor virtually. They are still allowing people to come in for their appointments, but they are leaning towards you using telehealth devices to do this, to protect everyone involved. They are no longer doing any elective procedures. They're rescheduling those for later dates. Only urgent and emergent procedures are continuing as scheduled. They are still doing community care referrals. So if you needed care that the VA medical center could not provide and you needed to go to a community medical care facility, they are still doing referrals, but it must be something that is urgent and medically necessary. All prescription refills are being mailed rather than veterans coming into the pharmacy to pick up their prescriptions. The VA regional offices are closed. However, all benefit payments are being processed as normal. They're still also processing new claims. Paperwork and payment extensions have been made due to these closures, and burials are still being held at national cemeteries. However, they are limiting these to 10 people in attendance. And there are no military funeral honor services being conducted at this time. The VA is testing and treating patients' symptoms with COVID-19. And the VA is following the Centers of Disease Control and Prevention's guidelines for testing criteria. So testing for COVID-19 is based on many factors, including severity of symptoms, other existing illnesses or conditions, and possible exposure. There is no charge for COVID-19 testing, and the VA has administered over 82,372 COVID-19 tests nationwide. As they do these tests, they are taking steps to prevent COVID-19 transmission, as we've seen with these changes being implemented. They ask if a veteran is experiencing symptoms of COVID-19 that they contact the VA medical center before going to a clinic, urgent care, or emergency room. And those symptoms are fever, coughing, and shortness of breath. They also are using their text message servicing, which is named Annie, and she can help monitor symptoms and advise veterans when to contact the VA medical center when their symptoms are becoming severe enough that they may need to seek medical attention. And right now, as with all other medical facilities, they can only provide supportive care as there is no treatment to cure COVID-19. They can only help treat symptoms of COVID-19. The impact of these changes on veterans are that their medical care and prescriptions and benefits are all still being provided. It's just in a different form now. And with this more online form of taking care of these things, there may be a feeling of a loss of sense in community and in-person social connections that I know the veterans really cherish and enjoy. It is probably very hard on many of them right now to not get to see their friends and their buddies at the VA, and they may be feeling lonely during this time. Telehealth is also being widely used at the VA, and many patients might not be familiar with telehealth. This may be their first time using telehealth. Many may be satisfied with telehealth, and then there may be some that are just satisfied with telehealth and would much rather see their doctor in person and really get a full exam. Also, there's no new admissions being made to long-term care facilities. So if a veteran is in need of entering a long-term care facility, they're not able to do so at this time, and that may put a lot of hardship on many families and veterans. It's also an anxious time for everyone, and it may be especially hard for veterans as they suffer other mental health issues, and often they really rely on each other for a support system, and they do this by coming to the VA to interact with each other and socialize, and they're not able to do that right now, and they may be feeling lonely and depressed. And also many of the mental health services they're being asked to do online. They are still allowed to come in for any mental health appointments, but many are probably doing so online, and that may not be as sufficient as it would be in person. Some future implications that these impacts made from the COVID-19 pandemic may have are that telehealth may become much more widely used. Both medical professionals and patients may find that telehealth is very useful and efficient and also cost effective. It's really indefinite on for how long the VA Medical Center may continue to take these extreme infectious disease precautions, as many of the veterans are of a vulnerable population to COVID-19 and at high risk of developing severe illness. No one's really sure when we can ease any of the restrictions, but the VA might definitely have to extend their precautions for a while to protect both the veteran patients and the staff at the hospital. what may come out of this is veterans may be on social media more. They may find that they really like interacting with each other through social media. And it may be a way for veterans to connect all over the country better, not just those in Johnson City, but all over the United States. These are my references. COVID-19 has had a major impact on all medical facilities, really everyone's daily lives, and these changes do have some certain implications, some of them positive and some of them not as positive. But the VA is doing all that they can right now to protect those vulnerable veteran patients, and I applaud them for that. Thank you.